Welcome everyone to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health, reporting for the week of July 22nd, 2024. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. The goal of the People's Health Briefing is to equip you with the best knowledge and insights to keep you, your loved ones, and your community as safe as possible. This week, after an update on COVID and H5N1, I will talk about things you might want to consider if you believe you were exposed to SARS-CoV-2. Starting off with wastewater, nationally, on average, it is now considered high. The last time it was this high nationally was just this past February, about midway down from our winter surge. So we're currently just heading right back up. Taking a look broken down by region, the last 45 days, we can see that the West Coast in teal is still the highest by quite a lot. It looked like it was leveling off for a bit there, but now it is heading up steeply again. The last time we were this high on the West Coast was in January, more kind of in the middle of our winter surge. The West is followed by the South, but really all regions are headed up. And when we take a look on the map, we can see that much of the country is high to very high. In fact, it looks like the only place in the whole country that is considered low is New York. Everywhere else is moderate or higher. So despite how much SARS-CoV-2 we've got circulating around, we don't seem to have as good of a handle on patterns or what to expect. We really still can't predict what this thing is going to do. Actually, for the first few years of the pandemic, we would sort of see waves coming from the UK, then to New York and the East Coast, and then making its way to the West Coast. But we really don't have, partly we don't have that type of reporting anymore. But we're also really just not seeing those patterns, or it doesn't seem like we're seeing those patterns anymore. So we don't even have what little predictability we used to have in that regard. And so there's always a lot of speculation, like, why are we having these big surges? And I think it just looks very different depending on where you are. Here in California, the weather's great. We're outside more. You would think maybe that we wouldn't be seeing such a huge surge, and then it might be higher in places that are extremely hot and where people are going indoors. So, we can speculate, but really SARS-CoV-2 is just pretty much still staying a step ahead of us, and we don't have that predictability that we wish we did. The one predictable thing that we do have that remains is kind of the order in which things occur in a given region. So wastewater goes up, then hospitalization goes up, then death goes up, and that is still the pattern. So taking a look at emergency department visits, those are heading up still pretty significantly. And taking a look at deaths, remember this is behind about a month, but unfortunately, as expected, it has already started going back up after coming down pretty nicely since mid-January. So it does seem that we probably hit our low point. We actually had 1 week where there were deaths less than 100. That was the week ending June 8th. That was the 1 week in this entire pandemic we've had less than 300 deaths. And given that all the other indicators are on the way up, the likelihood is that this was the low point for deaths because they have been going up since then. And we may not see it this low again until this time next year, if there is any predictability in the pattern, or if it is like prior years. So the week ending June 22nd, there were 385 deaths. And we've seen in the news, we've all seen a lot of things in the news, but among them is that President Biden tested positive for SARS-CoV-2. And taking a look at what happened, well, he got, of course, the presidential treatment. That's fine. He got a lot of testing. He got some sequencing, things that the average person would not get. But he did get something that the average person should be able to get, which is he got Paxlovid right away. He got symptoms, he got treatment. And this is how it should be for everyone. So I really hope that people are paying attention to this, including or especially doctors, because we're still unfortunately hearing that a lot of physicians are not prescribing Paxlovid as quickly or as often as they should. And I really hope that, especially given how many staffers the president has and how many people he comes into contact with, I really do hope that anyone and everyone that he may have transmitted it to will also be attended to just as rapidly. And really, anyone who came into contact with him, even for those few days before he became symptomatic, because we know that unfortunately we are contagious before we are symptomatic. So in this case, we could find out that you might have been exposed on the national news if you happen to be in contact with this particular positive individual, President Biden. But in most cases, it really requires someone who cares enough to let you know that they tested positive after seeing you. So hopefully you have those kind of people in your life. And it can be difficult to try to recollect everyone you've been in contact for a few days before you get symptoms. But I think this is something really important, basic, decent thing that we want to try to do, because you don't know everyone around you. You don't know their medical vulnerabilities. You don't know who they then go around. And so just err on the side of caution, let people know. Let them know you tested positive. Ideally, anyone you saw for about 3 days before you came down with symptoms, in the case of SARS-CoV-2. If you find out that what you had was the flu, kind of the nicer thing about flu is that it tends to declare itself much more quickly, meaning that your symptoms start and you become contagious pretty close to the same time. So if it's a flu, I would say letting those who you were in contact with for maybe 24 hours before symptoms start, that's probably adequate. But with COVID, about 3 days before symptoms or a positive test. Just a brief update on H5N1. I reported last week that there were 5 human cases from a poultry farm where they were culling. There's been millions of chickens being killed in all of this. But from that outbreak in Colorado, there are 2 more individuals who've been identified. That's for a total of 7. So far, it looks like they're all poultry to human transmission. And they've done sequencing, and the CDC has done sequencing and basically looks similar to what's being found in the cows. So we've got cows, we've got chickens, we've got both of those transmitting to humans. And we're all just kind of watching and waiting to see what happens next. So it's not a particularly good feeling because new things keep happening, like I've been mentioning. And that includes going from cows to chickens, cows to humans, chickens to humans. So none of that is good news. But so far, we still think that the risk to a person who does not work closely with animals is still low. But we know that that can change because all of this transmitting is just more opportunities for the virus to mutate and make a leap with pandemic potential. So we're certainly hoping that doesn't happen and hoping that we have learned some lessons. A little bit of good news on that front is that there's apparently been a rapid test developed to detect H5N1, and it's for the animals, but they have said that they are working on getting it ready for humans. They're getting ready to ship the one for testing animals to other parts of the world. And so hopefully this is something that we're going to see be available to test humans and animals at the point of care or the point of need. I hope that this really is a lesson that we learned from SARS-CoV-2 pandemic, that deploying rapid tests early, getting them into folks' hands quickly is going to be critical. So there is a little bit of hope there. And in the meantime, please don't consume raw milk or products made from raw milk, just to be on the safe side. Cook your meat thoroughly and don't touch any dead animals. Don't touch any wild birds. And if you work closely with animals, make sure you are monitoring the guidance that's coming from your field. So now for our topic today, I think most of us have been there. You get that phone call or that text or that email telling you that someone tested positive for SARS-CoV-2 at your meeting or at your gathering or at your conference. You still feel fine, but you know that it might just be a matter of days before you're not feeling well. So what do you do? So it turns out that there's a whole lot of correlation out there, different types of evidence of one thing or another that might help and probably won't hurt. And many of them, most of the category of not having robust clinical trials, not having those randomized double-blind controlled trials, which is what we would want for, let's say, medications or even supplements or vitamins or anything where we can do that type of study, which would be really the gold standard in that case. But it's not always necessary or even possible to do those type of trials. Those type of trials are expensive and time consuming, as we've talked about before. And sometimes they're impossible or just very, very difficult. Like it would be very difficult to try to do that type of study, for example, to assess the impact of sunlight on the course of COVID-19. Having said that, there are some studies and some indications of potential benefit of something like getting sunlight. And so we can look at different lines of evidence. We have also studies that show that raising your core temperature by going in a hot tub, drinking green tea, taking ginger, there are actually lines of evidence on that may point to the effectiveness of all of these things. And like, for example, we might understand that certain compounds help stimulate a part of the immune system that we know would help to defeat SARS-CoV-2 in the body. And if they're not harmful, if they don't have big side effects, then it could be worth doing. There may be a benefit and there's probably not going to be a harm. But I still think it's important for us to understand that that is very different from having direct evidence that something actually works. And the big problem that I think we're having in trying to get that kind of evidence is that there's not very much motivation to actually do the studies on these things. So, like I mentioned, they're expensive, they're labor intensive, and for many of these things, no one's going to be making money off of it. Or even if they could figure out how to make money off of these things, like let's say supplements or something like that, a study might not even be needed because it's not a regulated market and they can just make the claims and sell these less regulated things online or wherever without even doing the study. So, kind of any way you look at it, there's not a whole lot of motivation around these things because, for the most part, you're not going to be making money off of sunlight or ginger. So, just as a practical matter, and because of the profit motive around researching interventions and the cost, we may not get the types of studies that we truly want, at least not anytime soon. And it does kind of put us as physicians in a difficult situation because most of the time we'd like a decent level of evidence to recommend things to patients. But we also do know that there are things that fall into the category of might help, won't hurt, might even make you feel better, which has value in and of itself because we know that being anxious or depressed or worried does not help with healing. One thing we do know is that getting a good night's sleep is very helpful, and not sleeping well can actually make you more susceptible to doing more poorly with a virus, for example. Now, the other thing about the whole profit motive situation is that there also has to be a demand. And earlier in the pandemic, when really the only thing we had was monoclonal antibodies for treatment, we actually had monoclonal antibodies that you could take if you got exposed, but before you got sick. So we had monoclonals for post-exposure prophylaxis. So there was actually a time when if you got exposed, you could go on down to your infusion center with a recommendation from your doctor and get post-exposure prophylaxis with monoclonal antibodies. And for people, especially those who are at very high risk of a bad outcome, this was certainly a lifesaver. And it's sad that we no longer have this option. And apparently, this is in part because there was not a whole lot of demand for it. And with all of the mutations that SARS-CoV-2 has undergone, there would really have to be enough demand, I think, to be producing these things at the level that we would need in order to be able to access them for post-exposure prophylaxis. So it's just kind of sad. We now have very limited choices for any kind of outpatient infusions for COVID anymore. We're finally seeing PEMGARDA make it out into the community for pre-exposure prophylaxis. So that's pre-exposure. So, and that's for immunocompromised people, and it's still a little bit difficult to access, but that's about it. Nothing for post-exposure prophylaxis at all. Another thing I'll say about the motivation is that before we had vaccines and before we had treatment, really interesting studies were happening or seem to be happening a lot more. Taking a look at everything from melatonin and vitamin D, things again that aren't going to make anyone rich, but since we were just kind of grasping at straws and trying to learn whatever we could, wherever we could, there just seemed to be a lot more information coming out. And it was helpful information because it helped just improve our understanding overall about SARS-CoV-2 and about how it was affecting our bodies. And in a way, that's kind of what we're seeing now with long COVID. We still don't have anything approved, but we have different trials going on all over the world. Maybe some of them are repurposing drugs, or some of them are looking deeper into things that maybe are working. And some we have seen things unfold. Seems like once we got vaccine and Paxlovid, things slowed way down. But as we know, COVID has not slowed down, so we really do need to continue improving and increasing our understanding. And kind of an example of what I'm talking about is this recent study published just last week in the New England Journal of Medicine, another Paxlovid trial. So this was a trial to see if Paxlovid would be helpful in stopping you from getting COVID after exposure. So post-exposure prophylaxis trial with Paxlovid. And this was a double-blind randomized trial looking at over 2,700 participants. So you could see this was resource intensive, but they could do that because they're Pfizer and it's Paxlovid. They looked at a 5-day course and a 10-day course of Paxlovid. And the bottom line is there was no benefit. And I gotta tell you, I'm just not very impressed with this whole scenario. Why are we testing an antiviral in people who do not have the virus by antigen tests? So they tested by antigen. I would have much rather seen everyone get a PCR test to diagnose it as early as possible and get them Paxlovid if that's what's appropriate for them. This felt a little like just throwing things to the wall to see what sticks. And this is something very expensive that people do currently profit from. And obviously, if it worked, they would be profiting from it even more. And just throwing things at the wall to see if they stick isn't the best. And there may certainly be factors that I'm not aware of. But it's really not a surprise to me that it didn't work because Paxlovid is an antiviral. And if there's no virus there, then how is it going to work? And if you're very, very early on, then how about we just establish that with the PCR test? Paxlovid is not without side effects. It has drug-drug interactions. It's just not something we should be taking lightly. So what we're not going to do if we get exposed to SARS-CoV-2 and haven't turned positive yet, is what we're not going to take is Paxlovid. We're not going to take Paxlovid prophylactically. It doesn't work. There's no real basis that I'm aware of to suggest that it would work. Not sure why anyone thought it would work, but now we have more proof than we ever needed that indeed it does not work. So, like I mentioned, there are a lot of fascinating studies from all different points of the pandemic that are promising and, in my mind, fall into the category of may help or won't hurt. And rather than trying to go through each of them, especially because the quality of the evidence is quite variable, there's a lot of small studies, some are retrospective studies, some are looking in the lab. And again, these are all interesting and important things to help substantiate why you might want to go ahead and try, and especially if it's not going to hurt. But instead of trying to go through all of these things, I just went ahead with some of my favorites in the post. So if this is something of interest to you, you can take a look. If you get exposed, these are things you might want to think about. You might want to drink some green tea. There's some data supports that that's not a bad idea. Plus, it's relaxing and it's delicious and it's not going to hurt you. So, and it may actually help. And again, different pieces of evidence that support that. But again, not that definitive trial. But I will go through a couple of things that do seem to have some good evidence behind them. First is this article published this past December in the journal Clinical Nutrition. It's a randomized, double-blind, placebo-controlled trial. So that's really what we want before doing a drug study. In this case, it was on probiotics as post-exposure prophylaxis for COVID-19. And so after getting exposed, taking probiotics. And this was a study with 182 participants who had a household exposure to someone with confirmed COVID-19 within the previous week. So even though we know that household exposure doesn't 100% mean that you're going to get COVID, the risk is typically quite a bit higher than other types of exposure. And what they looked at was, did the study participants develop illness within 28 days of exposure? And they also did some stool collection to evaluate any changes in the microbiome. And I've talked about the microbiome here a few times because it does, I think we're learning that it is very important to a number of things that I think have been under-recognized in the past. But particularly, there are some promising findings related to long COVID and the microbiome. So I think we're going to keep learning more about this. There are many, many different probiotics out there to choose from, but this particular study was looking at Lactobacillus rhamnosus, or let's just call it LGG. And they did find that this probiotic delayed the onset of COVID and reduced the symptoms. It didn't reduce the overall incidence of getting COVID, but it was promising in that it did have an effect. It reduced the symptoms and it delayed the time to getting the infection, which we know that symptoms happen when there is an increased number of viral copies. And so this suggests that the probiotic slowed that down and reduced that overall. So like a lot of these studies, it's not a slam dunk, it's not the end all be all, but it definitely points to a positive effect and really sort of indicates that we need to do more studies on this. And it's also something that's not going to hurt. It may help other things as well because we know the microbiome is very important. There have been a number of other studies that look at other probiotics and have shown that they improve outcomes in patients who were already hospitalized with COVID-19. So I won't get too much into that because I'm wanting to focus on post-exposure prophylaxis as opposed to people who are already sick. But when we see studies like that that are showing that something is reducing the symptoms, it's reducing the duration, then I think it means we have to look at it seriously. And hopefully we will realize that it's important to look at post-exposure prophylaxis because one good thing that's come out of this entire ordeal is that people are more communicative and share when they get sick, they are contacting their people that they were around. So I think this is a great thing because before the pandemic, people didn't do that. They showed up to meetings with a sore throat, a little cough. I'm not feeling very well, but I'm pushing on through anyway. That was very normalized. And I think, at least to some extent, that is not as normalized anymore. And what is normalized is letting people know that they may have been exposed. So now that that is kind of a change, I feel like this is a great reason why having something you could actually do about it would be super, super helpful. So I think we need more of this and we need it now. There was another study I'm not going to go into too much detail on from 2021, so kind of pandemic early days, that showed that the oral probiotic called ENTK12, it's being called Bliss K12, significantly reduced respiratory tract infections among healthcare workers. And this particular probiotic is well established as part of the mouth microbiome. So it's really for the mouth and the upper part of the throat, so oral pharyngeal microbiome. We have talked before at great length about how important oral health is as it relates to COVID. And I've linked the prior briefings on that in case you're interested. But certainly appropriately populating the microbiome in the mouth and the top part of the throat, so in the oral pharynx, also looks like a promising strategy to protect people from a number of respiratory tract infections, including COVID-19. And on the topic of oral health, I've gone over this in detail, like I said, but CPC containing mouthwash, it has been shown to be helpful. I've posted a couple of articles about this in the Post. kind of a special mouthwash. And I think in general, maintaining excellent oral health is a good thing. Maintaining good oral flora is a good thing. I think there's nothing but upsides here. I don't think you can go wrong with that. There's also quite a bit of study around nasal irrigation. I did a deep dive on that previously, so the link to that is in the post. But saline nasal irrigation for adults with sterile water is another thing that we know has a number of benefits in terms of keeping the mucosa moist and healthy, reducing infectious agents in the nose, which is obviously the site of entry, the site where that we know that if it hangs around and continues to replicate, then it can proceed to cause us trouble. So anything we can do to reduce it is also likely going to have benefit, very unlikely to have any downside, other than you may not find it comfortable. Some people find it great. Some people do it every day and find that it is helpful for allergies and sinuses and other things like that. So just with the important caveat that we're using sterile water and that this is something that we're not doing in little children. You would really need to talk to your doctor about that. So in the post, we've got articles about ginger, about green tea, nasal irrigation, special mouthwash. So the last thing and sunlight. So the last thing I'm going to review now is a study on the efficacy of nitrous oxide nasal spray. You've seen these sold under a variety of brand names. This is another situation where the mechanisms of how it works make sense. So it is plausible that it could work. And these are things that they've been able to see, for example, in the lab. It inhibits the virus directly. It has benefits on protecting against pulmonary and cardiovascular issues. And it may even help to regulate the immune system. There have been some trials on people who already have COVID, and again, reducing symptoms and shortening the duration. And so these are all things that make it promising. And there seem to be some larger trials going on now to assess whether it can prevent progressing to COVID-19. And there are a number of studies showing that it reduces the amount of virus in the nose and again, helps people to get better faster. There's another nasal spray with an ingredient called Iota-Carrageenan. There were some studies also earlier in the pandemic. So with different variants, but the beauty of some of these things is that they're pretty much, they don't care what variant it is. In fact, they're probably helpful for other viruses too, that are spread by the respiratory route. So how helpful they'll be might be different now that we're talking about a vaccinated population and different variants and things of that nature. Might not be as effective, or maybe it's more effective. Again, we don't really have those kinds of studies, but there were some studies from earlier in the pandemic about Iota-Carrageenan nasal spray and it's significantly reducing the risk of healthcare workers from getting COVID-19. So definitely would love to see some larger, and in this case, would really like to see some placebo-controlled trials for these things because there is sort of some speculation about even some of the studies with mouthwashes and with the nasal spray that it's really just the actual motion of rinsing the mouth or rinsing the nose and not necessarily the special ingredient. So in order to assess that out, we would have to have some placebo-controlled trials. But in the meantime, some of these studies have shown that it's reducing the risk of getting COVID after exposure. And these nasal sprays are over the counter. They don't require a prescription, may be worth trying. Once again, probably not going to hurt and may help. And I've linked a couple of those articles on the nasal spray in the post as well. But truly, the most important things you can do if you get exposed are, first off, if you're someone who should be treated if you get COVID, use this time to get it all lined up. Make sure you know how you're getting the treatment. Have it ready for you if possible. You do not want to wait until you feel terrible to start scrambling for treatment. Secondly, don't get anyone else sick. Wear a mask, even at home. So if you can quarantine, great. Definitely do not go around others until you know you are in the clear. So if you think you're exposed, even if you don't have symptoms yet, just wait out the time Do your tests. So that's number 3, test frequently. And we reviewed this in a lot of detail last week, but you probably want to do at least 3 or 4 tests over the course of 6 or 7 days, but definitely test immediately if you start having any symptoms. And if you do test positive, please call everyone you've been around, you think you've been around in the preceding few days. And at this point, you are going to want to isolate, get your treatment if it's indicated, and please be sure to test out of isolation. Don't go back around others without a mask on until you are testing negative again. If you don't have a primary care provider, please get one. Don't wait until you need one to try to find one. Know how to reach them before you need them. Establish a relationship with your primary care provider. Get your blood pressure and your baseline labs checked, like cholesterol, hemoglobin A1C, and get the appropriate cancer screenings for your age and risk factors. Get your age appropriate vaccinations. Just know where you stand. And remember to eat a balanced diet, incorporate fresh foods, avoid sugary drinks and processed food. Get some regular physical activity unless you don't feel well. In that case, please get your rest. Manage your stress levels and get a good night's sleep. It is kind of hard to believe, but summer is coming to an end, at least where I am. Next week is the last full week of summer before kids go back to school. So we'll be taking next week off, and we will see you back again on Tuesday, August 6th. Thank you so much for joining us, and we'll see you then.